Hi, my name is Bryn Austin, and I am a registered nurse and a student at Emory University in the master's program to get my midwifery degree. I originally decided to become a nurse when I was probably about 15 years old because I really had a desire to help people and wanted to help people become the very best versions of themselves. When I was in ninth grade, that was solidified because my granny got cancer for the third time. She unfortunately passed away, and I was able to help her through that and be with her through the last couple months of her life. And during that time, I spent a lot of time in the hospital and got to see a lot of compassion given to her by the nurses and her other healthcare providers. A couple months after that, my dad and I went to Belize on a mission trip, and it was a very, very remote area of Belize. We helped build an aquaponic tilapia farm for sustainability for the people there. And on the last day that we were there, my dad started experiencing numbness and tingling in his hands and feet, which rapidly progressed to numbness. And when we were walking through the Atlanta airport, once we had just left Belize, he began stumbling up the escalators, and we laughed it off for a while and just kind of thought it was just really, really odd. But the next morning, he told my mom to take him to the emergency room. He walked in, and within an hour, he couldn't walk or move at all. It was a very scary week of unknowing diagnosis. He was eventually diagnosed with Guillain-Barré syndrome, which is a rare autoimmune disease. And with that, I again spent a lot of time in the hospital helping care for somebody that I loved. During that time, I decided that nursing was just what I was meant to do. It wasn't really ever a question, it just kind of was a calling that I knew. I didn't know what type of nursing I wanted to do at that point, but a couple years after all of that, I decided to become a CNA in an oncology unit. I'm in Roanoke, Virginia, where I'm from, and ever since that, I have fallen in love with, um, even more in love with helping people and helping them get well and sharing compassion and love for them. So after working as a CNA in the oncology unit, I eventually became a registered nurse, worked in the same unit. During all this time, I loved the oncology aspect of care, but I discovered that labor and delivery was what I actually really, really loved. Um, I love helping mothers feel empowered during birth, and it really makes me happy to be able to help bring life into the world and see what women can see that they are capable of. So yeah, so everything, like recovery with my patients, helping patients' family members, providing holistic care, all of these things motivated me to pursue further education to get my master's degree. Um, and I am very excited to continue this into the midwifery specialty. And so, with the midwifery specialty, I hope to provide comprehensive, holistic care to women of all childbearing and postmenopausal ages, whether it's through contraceptive care or family planning services, labor, delivery, postpartum, postmenopausal services. I really have a passion and a desire to help these women um, to feel that they are loved and important and cared for at any stage of their life. Anyways, I am very, very excited to continue this journey, and I'm very excited to see where it takes me. Thank you.